Welcome to the episode 1 of Chronicles of Dentistry. I'm Dr. Preeti and I will be your personal guide for all those dentistry related problems. So, let's get started with our first episode, Kernels of Anatomy. Why anatomy? Because anatomy is a very complicated and intricate subject. You need lots of understanding and lots of cramming to go through anatomy. So once you're done with anatomy, you just need revision because revision is the key in every exam, especially if it's anatomy. So what are the resources which I feel that you all should follow? It would be Dental Pulse or Dentist for MCQs and your basic book. I used to refer BDC and Gray's Anatomy for the diagram part. But choose one book for MCQs. I would say you should prefer Dental Pulse because most of the questions which are in the dentist, I would be covering them. So you don't need to worry about extra questions from dentist. And there are some basic concepts which every one of you should know. These should be by heart by you, and other few topics which will be covered in the MCQs, you can deal with them while solving questions. So the basic concepts are subclavian artery, external carotid artery, venous sinuses, cranial nerves, triangles of neck, larynx, pharynx, osteology and embryology. And regarding MCQs, I will be making separate videos for quizzes. So most of your MCQs will be covered in those quiz sections. Now let's get started with our first topic of today, that is arch of aorta. As you can see, three bulges at the end. These three bulges are called aortic sinuses. From the anterior aortic sinus, right coronary artery arises. From left posterior aortic sinus, left coronary artery arises. And from right posterior aortic sinus, there is no coronary artery because it is a non-coronary sinus. An arch of aorta arises from second costal cartilage. And then comes subclavian artery. So as you can see that at arch of aorta on the left side, there is a single branch which is actually dividing into two parts. And on the right side, there are two branches. So now imagine it as a mirror image. So your right will become your left and your left will become your right. So the single branch which is arising from the left side is actually the right side and it is called brachiocephalic trunk. This brachiocephalic trunk divides into two, right common carotid artery, the upper one, and right subclavian artery, the lower one. And on the left side, that is the right side of the image, there is left common carotid artery, the first one, and on the rearmost side, there is left subclavian artery. This subclavian artery is actually divided into three parts by anterior scalene muscle. Mesial to anterior scalene muscle, there is the first part of subclavian artery. Behind anterior scalene muscle, there is the second part, and lateral to the anterior scalene muscle, third part of the scalene subclavian artery is there. And this third part is where the most superficial pulsation can be felt when we apply deep pressure on the omonclavicular triangle. And also, the inferior trunk of brachial plexus lies posterior to the third part only. Now we'll talk about first part in detail. So from first part, there are three main arteries which are arising. That is vertebral artery, thoracocervical trunk, and internal thoracic artery. As for vertebral artery, it is transmitted by foramen transversarium, and foramen transversarium is actually exclusive to the cervical vertebra only. If we talk about thoracocervical give rise to three main branches: transverse cervical, suprascapular, and inferior thyroid. Then comes part 2 and part 3. From part 2, costocervical trunk arises, and from part 3, dorsal scapular artery arises. So let's recap what we learned today. From arch of aorta, there are 3 bulges called aortic sinuses. Anterior aortic sinus give rise to right coronary artery. Left posterior aortic sinus give rise to left coronary artery. And right posterior aortic sinus is non-coronary sinus. Arch of aorta actually arises from second costal cartilage at sternal angle of Louis. From arch of aorta, brachiocephalic trunk and left common carotid and left subclavian artery arises. From the left subclavian artery, left axillary artery arises, and from brachiocephalic trunk, right subclavian artery and right common carotid artery arises. Subclavian artery is divided into 3 parts by anterior scalene muscle. Part 1 is mesial to it, part 2 is posterior to it, and part 3 is lateral to it. This is the detailed view of how subclavian artery divides. Now let's recap about the parts of subclavian artery. From part 1, internal thoracic artery, thoracocervical trunk, and vertebral artery arises. Foramen transversarium, which is exclusive to the cervical vertebra, transmits vertebral artery. Thoracocervical trunk give rise to 3 arteries: suprascapular, transverse cervical, and inferior thyroid. And there is third one, internal thoracic artery. From second part, costocervical trunk arises, and from the third part, dorsal scapular artery arises. So now after subclavian artery, we'll come to common carotid artery. Common carotid artery is mainly divided into internal and external carotid artery, and it divides at the upper border of thyroid cartilage, that is the 4th cervical vertebral level. Internal carotid artery mainly supplies brain and orbit, and external one supplies face. We don't need to know much about internal carotid artery though, but still I'll tell you the parts. There are 4 parts: cervical, petrous, cavernous, and cerebral. Cerebral one is actually little bit important. So the parts of cerebral is ophthalmic artery, anterior cerebral artery, middle cerebral artery, posterior communicating artery, and anterior choroidal artery. The middle cerebral one is the largest one. Now comes to the external carotid artery. As you can see the image, it looks very complicated to understand. So we'll simplify it a little bit by doing just line diagrams. So from upper border of thyroid cartilage, external carotid artery gives rise to superior thyroid artery, lingual artery, and facial artery anteriorly. Superior thyroid one is below hyoid bone, and facial and lingual ones are above hyoid bone. There is only one medial branch, that is ascending pharyngeal artery, which actually runs parallel to the SCM, that is sternocleidomastoid muscle. Then comes 2 posterior branches. Both of them run along the border of posterior belly of digastric. At the lower border, occipital artery is there, and at the upper border, posterior auricular artery is there. Then there are 2 terminal branches. Superior one is actually superficial temporal artery, and the little lower one is maxillary artery. And from maxillary artery, there is little branch that arises called middle meningeal artery. If you injure this middle meningeal artery, extradural hematoma occurs. So now we come to how you're going to make your notes. Just divide one page of your register into 2 parts, the way it's shown in the image. In the upper section, write all the small points with diagram of subclavian artery and aortic arch. And at the lower section, just draw external carotid artery. And yes, you're done with your first lecture of anatomy. So let's come to quiz time. Your first question is, which of the following is not a branch of subclavian artery? Your options are internal thoracic, vertebral artery, costocervical trunk, suprascapular artery. So the correct answer is yes, suprascapular artery. It's not the branch of subclavian artery. What is it? It's actually a branch of thoracocervical trunk, which is a first part of subclavian artery. So here comes your second question. All of the following are branches of thoracocervical trunk except. Your options are inferior thyroid artery, transverse cervical artery, dorsal scapular artery, and suprascapular artery. So, what's the answer? Yes, dorsal scapular artery is not the branch of thyrocervical trunk. It's actually a third part of subclavian artery. If you want to watch more such episodes, do write yes in the comment section. See you in the next episode. Until then, keep reading, keep doing lots and lots of MCQs, and keep working hard. Bye bye. All the very best.